One Health, health of environment, human and animals. Today's topic, anthrax. We think that what is anthrax? Anthrax is a zoonotic disease caused by the gram-positive spore-forming non-motile rod-shaped bacteria Bacillus anthracis. It causes acute mortality in animals, mainly affecting herbivores and domestic animals. Types of anthrax: inhalational anthrax, cutaneous anthrax, gastrointestinal anthrax. Inhalational anthrax. Let us discuss about inhalational anthrax. People who work in places such as wool mills, slaughterhouses, and tanneries may breathe in these spores when working with infected animals or contaminated animal products from infected animals. It is one of the deadly forms of anthrax and can be the agent of bioterrorism. Gastrointestinal anthrax. Let us discuss about gastrointestinal anthrax. When a person eats raw or undercooked meat from an animal infected with anthrax, they can develop gastrointestinal anthrax. Once ingested, anthrax spores can affect the upper gastrointestinal tract, throat and esophagus, stomach and intestines. Cutaneous anthrax. Let us discuss about cutaneous anthrax. Cutaneous anthrax is a bacterial infection caused by Bacillus anthracis, an encapsulated gram-positive spore-forming bacillus. Although inhalational and gastrointestinal form of anthrax exist, approximately 95% of all anthrax cases are cutaneous. Incubation period of anthrax. Incubation period is from 1 to 7 days, although incubation periods up to 60 days are possible. In the prolonged outbreak, incubation period extended up to 40 days. Cause of anthrax. Let us discuss about cause of anthrax. The infection is caused by bacteria Bacillus anthracis, commonly found in the soil. It can remain under soil for about 40 years without decaying in the form of spore. Anthrax can be transmitted when spores are inhaled, ingested, or touched. Infected farm animals or their products such as meat and hide are touched. Undercooked meat from animals infected with anthrax are eaten. Illegal drugs are injected. Transmission of anthrax. Let us discuss about cutaneous anthrax. Coarse or exposed part of the body comes in contact with the spores of anthrax in the surrounding or in the soil and is transmitted to the people. The spores then move into the bloodstream from the exposed part. Another form of anthrax is gastrointestinal anthrax. People who eat uncooked or raw animal products like milk, meat, egg, etc. can get affected from this type of anthrax. Next form of anthrax is inhalational anthrax. People who are in direct contact with the infected animals are highly susceptible with this disease. The route of transmission of this disease is air. Symptoms of anthrax. Let us discuss about cutaneous anthrax. Swollen lymph nodes, raised itchy bump which develop into a painless sore with a black center. Gastrointestinal anthrax. Nausea, vomiting, abdominal pain, headache. Loss of appetite, fever, severe bloody diarrhea in the later stages of the disease. Swollen neck. inhalational anthrax, sore throat, mild fever, fatigue and muscle ache, chest discomfort, shortness of breath, nausea, coughing up blood, painful swallowing. Diagnosis of anthrax. Let us discuss about a diagnosis of anthrax. Skin test to diagnose cutaneous anthrax. Blood test to detect antibodies against anthrax bacteria in the blood. X-ray to diagnose inhalational anthrax. Stool test to diagnose gastrointestinal anthrax. Spinal tap, lumbar puncture to detect anthrax. Meningitis. Treatment of anthrax. Let us discuss about the treatment of anthrax. The standard treatment for anthrax is a course of an antibiotic for 60 days. You should use the medical treatment. Antibiotics prescribed to inhibit the growth of bacteria. Consult to specialist. Pulmonologist specializes in diagnosing and treating conditions that affect the respiratory system. Infectious disease specialist specializes in dealing with the diagnosis, control, and treatment of infections. Veterinarians for domestic or herbivores or infected animals. Prevention of anthrax. Let us discuss about the prevention of anthrax. People who are at high risk, such as those working in related research laboratories, should be given vaccination. Contact with infected animals should be avoided. In case of exposure to spores before symptoms develop, vaccination should be provided.